climate change is exacerbating a lot of health challenges, resurgence of vectors, malaria, to increased number of mosquitoes and other vector-borne diseases like dengue fever, for instance. Africa has very, very limited capacity in research and development, and therefore very little capacity to produce necessary countermeasures. If you have a climate-sensitive R&D, then you'd be able to project the likelihood of those scenarios and be able to also support innovation for the challenges that are likely to emerge. So you'd realize that Lassa fever, for instance, does not have a lot of countermeasures. It's among the neglected diseases that are endemic in Africa because we don't have R&D that is contextualized for the Africa region. So it's one of their priorities. And of course, we also have a priority on financing. Financing is like the enabler. No country in Africa has met the very humble, very, very modest Abuja target of allocating 15% of their budget. And very little is being put in R&D. No country in Africa has allocated more than 1% of their domestic GDP to R&D, research and development. We are working with different partners, coming together and connecting all the different engagements around financing so that we have financing priorities that respond to the challenges, including pandemic preparedness and response and climate adaptation